And a very warm welcome to BBC News. I'm James Dagwell. Now, Barack Obama isn't the first president to try to reform America's healthcare system, but he would appear to be the most determined resident of the White House to give it a go. He's just spent an hour being questioned by journalists during a news conference scheduled for a primetime TV audience, trying to drum up support for his plans. He accepted that the standard healthcare argument that it would be expensive, but he countered it by saying in the long run, better medical care would save America money. He also voiced what he said were deep concerns about the US debt and budget deficit, saying he was worried about government spending. Well, let's get some more details on all of this from our Washington correspondent, Jane O'Brien, who's there live for us. Jane, first of all, let's talk about the healthcare reforms. Are his plans running into difficulty?
Well, the biggest problem here is the cost. He wants to provide coverage to 47 million uninsured Americans, and that bill is likely to come to more than $1 trillion over the next 10 years. And even members of his own Democratic Party are balking at that. So that's the hard sell, and that's why the administration decided that the best person to put it to Americans, and indeed his own party and the health insurance industry, was the president himself. But he's also compounded his difficulties somewhat by imposing a pretty tight deadline on lawmakers to come up with a bill that will thrash out this reform. He wants them to have something on his desk by the time they break up for the summer recess. And one of the big questions at the press conference that ended just a few moments ago was, why the rush?
Number one, I'm rushed because I get letters every day from families that are being clobbered by healthcare costs. And they ask me, can you help? So I've got a middle-aged couple that will write me and they say, our daughter just found out she's got leukemia, and if I don't do something soon, we just either are going to go bankrupt or we're not going to be able to provide our daughter with the care that she needs. And in a country like ours, that's not right. So that's part of my rush. The second thing is the fact that if you don't set deadlines in this town, things don't happen.
Jane, the stakes are pretty high for President Obama, aren't they? This whole healthcare reform business, if you like, is almost putting his credibility on the line.
Well, it absolutely is putting his credibility on the line. He's invested a huge amount of political capital in this. He's placed healthcare reform at the centre of his presidency and indeed at the heart of his plans to rebuild America's economy. And he was telling Americans tonight that if he can't control healthcare costs, then there's no way he can control the deficit. But of course, that again is the big argument here, that nobody is really convinced that his plan will control the deficit. In fact, there is a very broad suggestion that it will add to it. And so that's what he's trying to convince Americans that that is what this is all about.
Now, I do think it's important to get this right. And if, at the end of the day, I do not yet see that we have it right, then I'm not going to sign a bill that, for example, adds to our deficit. I won't sign a bill that doesn't reduce healthcare inflation so that families as well as government are saving money.
Jane, this was President Obama's fourth prime-time news conference. He doesn't just talk about healthcare reform. He also addressed various other issues. Did he say anything of any note?
Well, he did touch on the broader economy and noted that some of the bailout money had been used by banks to increase their own investments. That was something that has been particularly resonant here in America over the last few days. Some reports had come out suggesting that banks had not used the money to increase lending. So he did admit that the culture on Wall Street still needed to be changed, but he said that the signs were good. that the financial markets were beginning to stabilise. But of course, that doesn't help ordinary Americans who are still seeing soaring unemployment. The national average is now 9.5%, and in some states it tops 10%. So he was also hoping to reassure Americans that the economy is on its way to recovery, and that, of course, healthcare reform is absolutely essential to that.
Jane O'Brien, live in Washington. Thanks very much indeed for that. We'll be getting the reaction of a Republican strategist to President Obama's speech a little later in the programme, so do stay with us for that if you can. Meanwhile, President Obama's healthcare news conference came at the end of a busy day in the White House. Earlier, he repeated his pledge to pull all American forces out of Iraq by the end of 2011. You're speaking at a news conference with the visiting Iraqi Prime Minister Nouri al-Maliki. Mr. Obama accepted that some violence is likely to continue, but insisted the insurgents would fail in their arms. Now let's move on to some other news here on the BBC. And violent protests are spreading across South Africa's townships as pressure mounts on President Jacob Zuma